My foreseeable trend would be less filler and more collagen building products, uh, modalities like lasers that can help build collagen, stimulate them versus doing quick fixes. Like the easy gel, like it's love putting, your own blood back into you. And so I feel like we're trying to get away from the fake look and more natural. And my tagline is enhance your natural beauty.
All right, Isla, nice to meet
Nice
you.
to meet you, Rebecca.
Welcome to the live podcast booth. Excited to be interviewing you for our Med Spa Owners Playbook. So tell me a little bit about your practice. Where's your practice located? How long have you been? And anything that you want to share about it.
Yes, my med spa is in Lodi, California.
Okay.
Cox Medical Esthetics.
Great wine over in Lodi.
Yes,
Some great zins.
very good zins. It's a small town. It is like we call it baby Napa town, but
Okay, I love Baby Napa.
I've been in practice for 3 years.
Okay,
And we just purchased a building and in the middle of remodeling it. So
great.
after,
So what drew you to medical aesthetics?
I have a passion for helping others. I'm an emergency room nurse practitioner at
Okay.
night. And
Oh, got
during
it.
the day, I
Oh, you are busy. You're doing both.
am. I'm a professor
right.
at Stanislaus State as well.
Holy cow. All right. And the chief of police
Nope,
and the fire.
no.
Got it. So you are busy. Okay. So the care of people, I think that's interesting. And I love that you say that, especially for the medical aesthetic industry, because a lot of traditional medical professionals do not see our industry that way.
They don't.
And I think it's a miss because once people come over, they totally get that there is a ton of patient care involved at a deeper level. Will you speak more about that and kind of like what your take on that is?
Yeah, I enjoy taking care of them at a deeper level. Actually, when I do my medical screening exams on them, I create a plan for a full year, telling them why. It's not a quick fix. This is a relationship that we're building. I need to learn their skin. I teach them about anatomy. I teach them about bone density, how they lose it as they age. I have this beautiful picture in my spa that I teach them. This is why you're starting to sag in the lower face, and then they understand it. And I explain my background, how I teach nurse practitioners, and that I work in the emergency room. But I balance my life by loving what I do in the aesthetics, by creating a relationship with them. It's not a one stop. It's not a one time sit in my chair.
Yeah. Right.
They will see me forever. It's a relationship, and I let them know, like, if you aren't comfortable with me, I know all the other spas in Lodi, and
Yeah.
I can refer you to them. And so I let them know that this is
Yeah.
a relationship.
That's nice. And they're probably comfortable too because you clearly have a strong ethical perspective as well. And I'm sure your patients feel that. So, what is your vision for your clinic? And remind me the name of your clinic.
Cox Medical Esthetics.
Cox Medical Esthetics. What's your vision for Cox Medical Esthetics? Do you view it as, do you want to grow? Do you want to expand? Are you going to take over the world?
Don't plan on taking over the world.
No, not plan. Okay.
But we are growing. That's why we purchased a building.
Right.
And I love to educate. So I'm in the middle of getting certified to get CEs for training aesthetic nurses there in my med spa. And then I also do mentoring. And so I'm just trying to touch other aesthetic places and helping encourage anybody who's wanting to dive into the industry that it's a relationship. It's not a quick fix. They don't get 15-minute Botox. They get an hour because I need to make sure that they're comfortable with their change and everything like that.
Yeah, no, that's awesome. I love that. I really appreciate and respect that a lot. I think that too frequently people are rushed in and rushed out. And I think there's a balance to that. I think that we don't want to treat people like numbers because, again, a lot of the people that are in this industry, they got into medicine to take care of people. So we don't want to lose that aspect of it. And so there is finding that balance between being this luxury industry and this like elective aesthetic and this side of medicine where we care for people. And I feel like I kind of know this, but I'm going to ask you anyways, which is, amidst the competition, those other people in the industry, what would you say is your superpower at your clinic?
My superpower would be my caring, that I invest in my clients for them. I understand where they're coming from. I work, in their budget. I have a lot of, it's an agricultural area. And I understand that they're choosing me. They don't have to be with me. And I always thank them for sitting in my chair, that I know that this is a choice that they made.
Yeah,
I think that's what is the
I love
difference.
that. That is a superpower. I would agree with that. And usually we're like, what, in three words or less, how would you describe it? And I'm like, yours would be
Yeah,
caring,
it
right?
would be Carrie.
It would be intentional caring.
Yes.
So I love and appreciate that. So in the time that you've had in the industry, what are you seeing that you kind of have your eye on as far as foreseeable trends?
My foreseeable trend would be less filler and more collagen building products, uh, modalities like lasers that can help build collagen, stimulate them versus doing quick fixes. Like the easy gel, like it's love putting, your own blood back into you. And so I always, I feel like we're trying to get away from the fake look and more natural. And my tagline is enhance your natural beauty. And
Love it.
so
I
I
love that.
love to say, let's not overfill. Let's look at your natural beauty where you were. And I actually have a few people who show me pictures when they were younger, and I tell them, I would love to get you not back to that, but
Yeah.
let's soften up your face. So,
Yeah.
so
I love that. So, and usually this is where we'd end, but I'm curious. I have one more question. So when we're talking about stimulating your own collagen, what is your favorite product?
my favorite product is the PRP. Oh no,
Okay.
actually I have to take that back. Sorry.
Okay.
It's
Okay.
Sculptra.
Yeah. Okay.
Sorry,
That's my
it's
favorite product too.
Sculptra.
So I was like, I love
I'll
Sculptra. I
get
don't think
anything.
that I really don't feel like enough people talk about
They
Sculptra,
don't.
and it's been around for a very long time, but the way that we had to mix it in prior years, like you had to pre-mix it and you had to sit on a shelf and then a person doesn't show and then it gets thrown away. Like that was such a nightmare because it's not a cheap product. Training wasn't really there, but I feel like they've adjusted the formula. The training and support is there. It's an incredible product that I feel like needs more
I
visibility.
agree.
And I think that people would be so happy and impressed with the results, including men. Because the thing with men with filler, for me personally, is that it can be a little more feminine.
Yes.
And because of the way that we inject. But Sculptra, it's like, it just brings back that mwah, that je ne sais quoi. So I love that we have that in common. So I really love Sculptra. So I'm glad there's another advocate out there spreading the Sculptra gospel.
I tell everybody about Sculptra.
Right? But it was so nice chatting
Nice
with
chatting
you.
with you.
And thanks for spending time with
Thank
us
you.
and for pushing your hair down with some headphones today.
I'll pop it back.
Right? And no, I'll have to do the same. Thanks,
Thanks,
Isla.
Rebecca.